So she proceeded to try to go up and get my son off the 5th floor. I happened to ask the nurse, where's the charge nurse? She said, I think she went up to get your son. So I took off running behind her. She was already up there on the 5th floor trying to get my son. And the nurse that took my son from me, when she held her hands out, she still had my son in her hands. She said, he is fine. The charge nurse says, I will get somebody downstairs to help you. And obviously I know the children's hospital, they have a lot of patients and they have stuff that they need to do. And they can't just hold my son all night. So I said, okay, he's downstairs with me. He may not be in the same room, as they put him in a different room next to us with one of the nurses. Her name happened to be Danielle as well. So I'm back in there with Zamara. My cousin Nicole shows up. And she's there for the rest of the night with me. And it just, I kept asking them over and over, please call oncology. That is their job. As in the video, they just kept telling me I had to wait. And I kept telling them, I don't think we have until 8 o'clock in the morning, as oncology reassured me we were a family now and that they would be there. Well, they weren't there when I needed them the most. And so they just kept pushing it off. I didn't even have a resident doctor come in until 3:30, 4 o'clock in the morning. They tell me that the pediatric ICU doctor will be there shortly after the resident doctor had come in. Shortly after the pediatric ICU doctor came in, they had called respiratory. Respiratory had come in, and by then I was trying to hold the oxygen mask to Zamara's face before they called respiratory, as her oxygen level was just at a 90 about then, not where it should have been. She was kind of getting a little delusional. All the medication they had her on, she was trying, every time she would scream as we would try to put the mask over her face and put the thing on her head, she would scream. So finally I said, okay, I'm just going to hold it because she's wasting her breath. And you could tell she was struggling. So I just tried to hold it as best as I could. The video I took was for proof because all night I'd been begging for help. Begging them for help in oncology for them to do their job and to get there. And I was denied all that help. So respiratory came in, the fucking retarded nurse. She kept requesting, after we got the first prongs in, they had to keep sedating her because she kept screaming and trying to rip the prongs off from her face. The nurse says, them aren't the right prongs, so we need to change them. But every time they pulled the prongs away from Zamara's face, she would let out this scream at them, and her oxygen would plummet down to the 50s and 60s. 3 times the respiratory worker attempted to change her prongs, and all 3 times I said, just stop. Leave the one she has in. Her oxygen is staying where it's at. Fuck the prongs. Like, finally, the young respiratory worker, he turned around and told that nurse, I'm not doing it no more, and he walked out. By then, I had to step out for a minute. My cousin Nicole was there to sit with Zamara. I was maybe gone 2 minutes. I had walked off the unit, as I usually didn't do that. And I had to, because I was about ready to rip this nurse's face off, and I couldn't allow myself to do that because I needed to be there for Zamara and my son, who happened to be 25 days old at the time. So something told me to turn back around and go back to the unit. So I get maybe to the ICU unit doors, and my cousin Nikki texts me, and she says, you need to get back in here now. I said, I'm at the doors, but nobody's answering the phone. So I see the side door open, but all the other doors to the unit were locked. They were not answering the phone to let anyone back on the unit. So a nurse happened to walk out, and I happened to shove her aside and take off running into the room. And Nikki was out there yelling at them, you need to have someone come in here. And she happened to see me, so I get in there, and she said, yo, D, Zamara's bleeding from her nose, but they told Nikki it was from the prongs. So then they had another respiratory worker come in and put this big giant tube mask on her. And I had already done research on the side about the neuroblastoma and how they go. And her kidneys were failing, her liver was failing, she was dry drowning from them overflooding her system. The bleeding from her nose, I said, no, it's not. Her body's shutting down. So now she has this big mask on. She's bleeding now from her nose and her mouth. As I'm consistently wiping my baby's blood off her face that was dripping from this mask. They had this suction thing that I had to consistently keep sticking up in there to suck the rest of the stuff I couldn't wipe away because I couldn't pull the oxygen mask away. So 7 o'clock rolls around. It's almost shift change. We get a new nurse in there. Bobby was her name. And Bobby, you were fantastic. So the nurse, the retarded nurse I had all night, the young nurse, again, she wanted to give Zamara a catheter. And I lost it by then. I had threatened to rip her face off. I had told her if she didn't get the fuck out of my room and just let me hold my daughter, that I was personally going to rip the cords off her as myself because it wasn't fair. Like, Zamara was held on by the oxygen mask. That was all that was holding Zamara there. So the nurse, Bobby, she said they didn't let you hold her. And I said, no, they wouldn't let me pick her up or hold her. And I just wanted to hold my baby, as I know I didn't have long with her anymore. So Bobby, the retarded nurse, she turned around and she walked out. And I'm glad she did. Bobby said, get up there. And she helped me pick my daughter up, who had just turned 2 December 16th. And now could not hold her own head up. Was like a newborn, flopping her head. And I just held her until oncology got there at 8 o'clock in the morning. 8:47, my daughter passed away. And between them, 47 minutes after oncology came in there, it was just all apologies from everybody. As I'm having to take this vacuum thing and suck the foam out of my daughter's mouth underneath the mask and wipe her blood away. Finally, they said, whenever you're ready, it's time. I had to make that call. So I held her and I held her. And I said enough was enough, because it had been torture for Zamara throughout this month. She had developed PTSD from medical being done to her. She would scream in the middle of the night, grabbing her arms. She would refuse to lay down and fall asleep anymore. It wasn't okay. The alarm would go off for the bracelets, and she would run off screaming to me. And Zamara was holding up, I guess. And it wasn't... I had to make the call anyway when to take the mask off. And I did, because it wasn't fair anymore. After 2, 3 o'clock, 4 o'clock, it wasn't fair anymore. So, and nobody else could make that call but oncology. So when they got there, it was time. So they took her mask. They told me I could disconnect her mask. They gave her some medicine to help, I guess, keep her sedated or whatever. She wasn't even there anymore. So I took her mask off and I held her. As in the picture that's on there, the video that I have of that big blue mask, the tube that was coming off from her. My cousin Nikki took that, and I didn't even know she took it, as that was the last picture I ever got with my daughter. I had placed my hand on her heart and her chest, and I had sang, "You Are My Sunshine" to her, because that was the song I sang to her every night as I rocked her to sleep. I had just stopped breastfeeding her 4 months prior to this.